Congratulations on the birth of your baby. Our midwifery team here at Mid Yorkshire Hospital's NHS Trust have put together this information video about what to expect when you return home after giving birth. We know there's a lot to take in, so this video is also available on our website for you to watch again at your convenience. For further information, please download the Postnatal Care and Support booklet, which can be accessed via your Maternity Notes app. Please let your midwife know if you do not have access to the app so we can arrange for you to get a paper copy. Returning home with your newborn baby can be an exciting and sometimes anxious time for new parents. We'd like to reassure you that we are here with you every step of the way as you get to know your new baby. After your return home, your community midwife will visit you on the first day following your discharge. Your personalised care plan will be created with your midwife and the frequency of home visits established. Please contact Gate 18 on 01924 541 693 if you don't receive a visit, as it's important that you get this first visit.
It's really important that you take care of yourself following your birth. And remember, it may take several weeks for your body to feel the way it did pre-pregnancy. At each contact, your midwife will ask you about your emotional well-being. But here are a few things which you may experience. After a vaginal birth, you may experience discomfort and stinging for the first few days, and it's important that you keep the area clean and dry. If you've had stitches, you'll need to bathe them each day to help prevent infection. Painkillers and cold compresses such as gel pads may help to ease the pain. But please contact your midwife or GP if the pain gets worse or you suspect there may be an infection. Vaginal bleeding may be quite heavy at first and continue for 6 weeks. It will eventually progress to a pink-brown colour rather than red. If you're losing blood in large clots, tell your midwife. It's quite normal to pass small blood clots, but your midwife can advise you what is within normal range and if treatment is required. Following a caesarean birth, you should begin to see healing within a couple of days. Internally, this can take a few months. It's completely normal to experience discomfort during this time, but it will gradually ease. Gently clean and dry the wound each day. You may find it beneficial to wear loose clothing and take regular painkillers. Contact your midwife or GP if you think the area might be infected or you feel unwell or feverish. After a caesarean birth, it's important not to lift anything heavier than your baby in the first few weeks. This includes not lifting your pram up or down stairs, not carrying your baby in a car seat, and not carrying heavy shopping. It may be a couple of days before you open your bowels, and certain medication can cause you to feel constipated or even loose stools. Drinking plenty of fluid and eating fruit and fibre may help. You may need some gentle laxatives. However, if the problem persists more than 3 days, you should contact your GP for advice. Piles are very common after a baby, but usually disappear within a few days. We will ensure that you have passed urine prior to discharge, but please let your community midwife know if you have any concerns. After giving birth, it's common to leak a little bit of wee if you laugh, cough or move suddenly. Pelvic floor exercises can help strengthen the muscles around your bladder, vagina and anus. Visit the NHS website for instructions and links to exercise videos. Being active may feel like a challenge when you're tired, but gentle exercise after childbirth can help your body to recover and may help you to feel more energetic. At each postnatal visit at home, your midwife will assess your overall health and discuss topics that may affect your daily life, including psychological and emotional well-being, Safeguarding concerns including domestic abuse and physical health, including signs and symptoms of thrombosis.
Following the birth of your baby, there are some symptoms that may indicate a serious concern that you should be aware of. While some of these symptoms may be normal after birth, it is important that you seek medical attention if you have sudden heavy bleeding with symptoms of shock, such as feeling dizzy or faint, feel unwell with a fever and offensive discharge. This may indicate an infection. Have a headache which is accompanied by visual disturbances, nausea or sickness. Experience pain, swelling or redness to the calf area. This may indicate a blood clot. Are having breathing problems, shortness of breath or chest pain. If you experience any of these symptoms, you should contact our triage department on 01924 543 003 or dial 999 immediately if symptoms are severe.
Having a baby is a life-changing experience. It's physically challenging but also deeply emotional, and it's natural for new parents to feel overwhelmed and anxious. Getting to know your baby and having a new routine will take time, so be kind to yourself and take things at your own baby's pace. You probably find you experience a range of feelings and emotions, perhaps joy, pride, love mixed with anxiety, tearfulness and stress. These feelings are normal and you can expect to feel up and down as you get used to your new role. Experiencing baby blues is very common and it's thought to be due to the sudden hormonal and chemical changes that take place in your body after childbirth. Symptoms include feeling emotional, irritable, tearful, anxious and low in mood. These usually only last a few days and usually pass within 2 weeks after birth. These symptoms are usually normal, but it's a good idea to note how you're feeling and seek help if you're worried. Our perinatal specialist midwife is available to offer additional support. Some people find that revisiting their birth experience helps with their emotional well-being, especially if it didn't go according to their expectations. You may want to discuss this before you go home from hospital, or it may be several months before you have fully processed your experience and feel ready to talk about it. Please let your community midwife know if you would like to access our Birth Matters clinic to speak to our specialist midwife about your experience.
For parents, a crying baby can be upsetting and also frustrating. However, a baby's cry is designed to get your attention and is completely normal. For further information, you can access www.iconcope.org, which is a program aimed at helping parents and carers with young babies to cope with infant crying. Your baby may start to cry more frequently at about 2 weeks of age. The crying may get more frequent and last longer during the next weeks, hitting a peak at about 6 to 8 weeks. Every baby is different, but after about 8 weeks, babies start to cry less and less each week. ICON will provide you with techniques to cope. Remember, infant crying is normal and it will stop. Comfort methods can sometimes help, and it's okay to walk away if it's getting to you, once you've checked that your baby is safe. And never shake or hurt a baby. Sometimes babies cry because they're unwell. Visit the NHS website for the warning signs that their crying might be caused by something more serious, or contact 111 or 999 in an emergency. The safest place for your baby to sleep is a separate cot or Moses basket in the same room as you for the first 6 months, even during the day. It can reduce the chance of sudden infant death syndrome, or SIDS. Here are some tips for safer sleeping. When putting your baby down for a sleep, Place them on their back with their feet at the foot end of the cot. Firmly tuck in sheets or blankets no higher than the baby's shoulders. Make sure the cot or Moses basket is free from any toys, teddies or loose blankets. The baby's head and face should be uncovered and no hats worn indoors. Babies don't need to wear hats indoors, especially when they're sleeping. Newborn babies lose body heat through their heads, which is why we provided a hat for your baby to wear immediately after birth. Make sure the room is not too hot. The ideal temperature is between 16 and 20 degrees centigrade. Do not sleep on a sofa or armchair with your baby. And babies should be kept out of smoky environments, including the home and the car.
Closeness and skin-to-skin contact frequently helps you learn about your baby's feeding cues. You can expect your baby to feed 5 to 6 times in their first 24 hours. After this point, your baby will start to feed more frequently, taking 8 to 12 feeds over a 24-hour period. It's useful to keep a diary for feed times, length of feeds if breastfeeding, amounts of milk if bottle feeding, and if your baby has had a wet or dirty nappy. We recommend that you feed your baby responsively rather than sticking to a strict regime for both breast and bottle-fed babies, ensuring that they have 8 to 12 feeds in 24 hours. For breastfed babies, periods of cluster feeding is very normal and can occur during the day or night. During this time, your baby may feed quite a lot during a 3 to 4 hour period. You can understand more about paced bottle feeding by watching our responsive bottle feeding video available on our website. If you choose to breastfeed, it shouldn't be painful throughout the entire feed. Talk to your midwife about attaching your baby to the breast if you feel it isn't right. Your baby will come off the breast themselves and be settled if they have had enough milk. Seek out support if you feel something isn't okay. Trust your instincts. Observing your baby's nappies is a really good way of knowing if your baby is getting enough milk. The Off to the Best Start leaflet, which can be found on your Maternity Notes app, shows images of how your baby's poo changes during their first week. If you feel concerned about any feeding issues, please contact your midwife. Our specialist midwives will be able to provide extra support. Taking care of your breasts is important whether you breast or formula feed, as you will still produce milk. If you are using formula, try not to overstimulate the breasts, as this will encourage milk production. Use hand expression to relieve pressure if needed. Ensure you wear a well-fitted nursing bra and avoid underwires, as these can cause blocked ducts. Sore breasts can be painful and can occur when the milk flow in your breast is blocked. Your breast may feel tender, there may or may not be redness or a hard spot or sore lump in your breast. If the area becomes swollen, painful, hot to touch, or you have flu-like symptoms, you may have developed an infection known as mastitis. If you develop any of these symptoms, seek help from your GP or midwife. If you are formula feeding, please ensure the midwife discharging you has discussed how to make up a feed safely and also how to sterilise your feeding equipment. Breastfeeding support groups are available, and these include Families and Babies, or FAB, and Anti-PAMS.
Contraception is an important part of your postnatal care, even if it is the last thing on your mind at the moment. Many unplanned pregnancies occur within the first few months of having a baby, so it's best to be prepared. It is advised that you begin contraception from 3 weeks, that's 21 days after birth. It's possible to conceive before your period returns. There are short-acting methods of contraception which are reversible, meaning that once you stop using them, the effects wear off quickly and fertility returns. These include progesterone-only pills, combined pill, condoms and the contraceptive patch. Long-acting methods are more effective than short-acting methods. They last longer, so you do not need to remember to take them or use them every day. Examples include contraceptive implant or injection, intrauterine contraception and sterilisation. More information on your contraception choices can be found in the postnatal booklet available on the Maternity Notes app. Now that your baby has been born, it is the law that the birth is registered within 42 days. It is during this appointment that you will receive your baby's birth certificate. This is done at your local register office. If you live outside the area where your baby was born, or move away from the area before you are able to register the birth of your baby, you can make an appointment with one of the registrars in an area which is easier for you to attend to make a declaration. If you do this, the information is then passed to the area where your baby was born.
We value your feedback and use this to make improvements to our service. Please take a few minutes to complete our Friends and Family survey. The link can be found on your Maternity Notes app, or you can ask your midwife for a card before you are discharged. Once again, congratulations on the birth of your baby. We hope that this video has given you a good introduction of what to expect next, and we wish you and your family all the best in your journey.